Is AML hereditary? If someone in my family has a blood cancer, does that put me at higher risk of getting AML?
So I think only in these rare circumstances where people have a genetic predisposition that is inherited. By and large, the vast majority of cases are not inherited. And we're going to talk a lot about gene mutations and chromosome abnormalities in this disease, but these abnormalities, generally speaking, only affect the leukemic cells themselves, the abnormal blood cells. So they're not passed on, they are not inherited, and so we generally do not think of this as an inherited disorder.
So blood cancers come in many different varieties. There are, let's say, four major groups: chronic lymphocytic leukemia, chronic myeloid leukemia, acute lymphocytic leukemia, and acute myeloblastic leukemia. So these are very different diseases, and there is essentially no connection between them except when a pre-leukemia in myelodysplastic syndromes develops into an acute leukemia. I didn't mention the MDS, myelodysplastic syndromes, or when a chronic myeloid leukemia transforms into an acute myeloid leukemia. So to answer this question, there are families that have an increased incidence of myeloid leukemias. I'm talking only about myeloid. And there is a famous gene, P53, that can predispose to these leukemias. It's called Li-Fraumeni syndrome, and that runs in families. Patients have ovarian cancer, breast cancer, sarcoma, and AML, usually at an early age. But that is the best defined family syndrome. It's very, very rare, fortunately. So in general, yes, it's worth talking about it if you have myeloid leukemia in your family. But the incidence in families is really low.